Good evening, everyone. Welcome to, good evening, everyone. Thank you for joining us today. This is Hotline 21 CAN TV. You're watching a live call-in show, so I'd ask you to please call in. The number is 312-738-1060. I'm here today with Dr. Victor Bernstein, and we're both from Beacon Therapeutic Diagnostic and Treatment Center. I'm going to put some contact information on about Beacon and then talk a little bit about Beacon, and then Victor and I will start talking. So these are our 4 different locations. We're located in the Beverly area. We have our business office that's at 1912 West 103rd. Our Longwood campus is at 10650 South Longwood. Our Calumet campus is in Calumet Park on Ada. And our homeless outreach services is located on Western Avenue. Just a little bit of background about Beacon. We've been in existence since 1968. We started off as a therapeutic day school for parents who were looking for special education services for their children. And since then, we've evolved to a multi-service site where we're providing early Head Start services, and I'll actually put up some of our other programs. We have a little and big intensive outpatient program that we'll hear a little bit more about, but essentially it's a day treatment program for children in need of more specialized care beyond, traditional, Head Start daycare, and is also as a step-down program to a hospitalization. We have an outpatient mental health clinic so that anyone in need of services can access those services. Our FACT project, our Family Assertive Community Treatment, is a designated program to work with 18 to 25-year-old moms who have one child under the age of 5 and are homeless or at risk of homelessness. We do offer Early Head Start. It's a program that works with 0 to 3-year-olds. Our Shelter Outreach Services that provides mobile mental health services to homeless women and children. Our CHIPRA program that enrolls families and children in healthcare, and of course our therapeutic day schools are elementary and high school. I'm here today with Dr. Victor Bernstein, very pleased to have him here today. Dr. Bernstein is an associate research professor at, and I'm going to try and get this right, at the School of Social Administration at U of C. He's a consultant, trainer, and co-founder of the Autistic Prevention Fund here in Illinois. He also has tremendous strength and interest in looking at the parent-child relationship, and this began back in 1969. So I'm just going to ask you, I'm going to call you Victor, if that's okay, if you can tell me a little bit about yourself and your professional history.
Oh, I'd be glad to. Well, I started working with Head Start in 1969, and one of the things that interested me the most was trying to understand how children learn to communicate before they learn to talk. And that led me into studying infants, and I got to see a videotape of a parent and a child interacting presented by Dr. Brazelton, who's the new Dr. Spock, and he said, "Look at that baby's toes. That means he's happy." I said, "Wow, how did he know that?"
It's in the toes.
So I'm just fascinated about the meaning of children's behavior, especially when they're not using language, what's going on with them. And many of the children at Beacon have all kinds of problem behaviors, and I think they really are trying to communicate something. And my job, I think, is to help the children and their parents and the staff that work with them better understand what the children are trying to say.
Well, that actually, it's a nice segue in terms of how is it that you're working with Beacon? How have you become involved with Beacon?
Well, it started 4 years ago. I was part of a grant from the Illinois Children's Mental Health Partnership to really help try and strengthen services for infants and young children in community mental health centers. And that's because staff knew a lot about working with adults or working with individual children, but we know for young children, to be effective, we have to work with the whole family. And so that was my interest, and then I had a chance to come work at Beacon, and I've been there ever since.
Well, your role has really expanded since then. So maybe can you describe a little bit about, you're working with staff, you're working with groups, describe your various facets of your role with Beacon.
Well, it is kind of complicated. I think what we've learned is that a lot of the children that Beacon serves and their parents also have experienced what we call psychological or physical trauma. And that really affects how you feel inside, and it affects how you behave. And when we see that, when we who are working with these families see that, it's very upsetting to see how these families have suffered, and we kind of suffer along with them. And it can be exhausting, and it can be debilitating, both not only for the children and the parents, but also for the staff who work for them. So I think it was your wisdom that asked me to not only to expand my work from working directly with the young children and in the children's programs into working more directly with the staff to help them become more aware of how they're being affected by what it's like to do this work.
And it's interesting you bring up a couple of things that made me realize, one of the things that we've looked at is to run a good organization. I've really grown to believe that is being able to understand our role and utilizing reflective practice, reflective administration, but also recognizing the impact on the philosophy of care and the impact of trauma and the impact on the providers. So can you describe a little bit about what reflective practice and reflective administration is?
Well, I think I'd like to start kind of like if we can understand the children and we can kind of bring it on up through the organization. Mm-hmm. And this is what we call the parallel process. What happens with the kids is when something upsetting happens to them, they tend to act out and fall apart. Mm-hmm. They haven't developed the tools to try and calm themselves or not automatically react with the biggest upset possible. And the parents also tend to get very upset very easily. And so the children and parents kind of have this cycle going of being very reactive to one another. And everybody needs help learning to slow down and think about what's going on rather than just reacting to your emotions, reacting to your feelings. And that process of helping people slow down is really called reflective practice. And we try to help parents think about the meaning of their children's behavior, what's happening inside of them, how is it affecting them. And then staff, when they see upsetting things happen, they tend to react also. Mm-hmm. And so staff need help learning to stay calm and try to be supportive rather than reactive. I'll give you an example. Sometimes when children are a little older, we say they have ADHD, attention deficit hyperactivity disorder, which means they're all over the place. They tend to react. They tend to have tantrums. They get disorganized in their behavior. We give them medication and we put them in an environment where things are done in a very organized, behavioral way. But I think it's important to understand their behavior has meaning. And when we can understand what they're trying to communicate, we realize we don't only have to have rules and guidance for them, but we have to try and let them know we understand. And staff, I think if they're agitated and upset by what they're experiencing, which is not uncommon, if somebody's swearing at you or throwing something at you, it's kind of hard to protect yourself and control your feelings. It's hard to put yourself in an understanding frame of mind. And that's what we work on a lot together, because staff really want to understand and help the children, and we need to think about our work, not to be reactive, but to slow down and think about what's happening. We call that reflective practice, and that can really help people enjoy their work more and not get so burned out.
And I think one piece with that is also it's very much a strengths-based approach. And one thing that I've learned is really looking at when it works, why does it work? And how do you build on that? And I think that's so important where we have families that we're working with that you don't see many times, you don't feel like there's a lot of success. And so can you describe a little bit about that, how that works and how that reinforces the positive work that goes on? Well,
when you're upset, your attention's drawn to the problem. And I call it stress-itis and stress-itis. You're kind of you're deafened and blinded to seeing when things are working better. And I think if one can first calm down, it's easier to think about what else is happening with the child or a family. And for example, these families have lots of struggles they're up against, but were they able to get that kid up in the morning and get them ready to come to Beacon? That's not easy when you're going through all kinds of stuff. And that's a very positive thing. And that's what we mean by trying to figure out how are these families coping when they're up against such huge barriers, if they're homeless, if they're living with domestic violence, if somebody's getting shot in the neighborhood right in front of their house, which happens way too frequently. How often do our bus routes have to change their route and change their schedule, driving the children home from the program? There's a lot going on that many of us have never experienced, and they have to learn how to be able to cope with that. And the coping is one of the greatest strengths that these families bring, and it's one of the, and the staff, one of the greatest strengths that the staff bring is this huge capacity to care, and we all have to see when things are going better.
One other thing, just like to remind everyone, this is a live call-in show, so if you have any questions or comments, please feel free to call us. Otherwise, you're going to keep on hearing us talk for the next 20 or so minutes. That number is 312-738-1060. We're from Beacon Therapeutic. My name is Susan Reyna, and I'm here today with Dr. Victor Bernstein, and we're talking about the work that Dr. Bernstein does with Beacon. Tell me a little bit about the philosophy of care and how you've seen it played out in the work that we do and the impact of trauma and understanding trauma.
Well, I think the philosophy of care, one of the things that I just really like about Beacon is these families are some of the families who've experienced the most difficult things possible. Many of the parents have been wards of the state and have never had an experience of a stable home life or a consistent caring relationship. And very often the families are told what to do and they're expected to follow. But what's wonderful about Beacon is one of the primary things about the philosophy of care is people have worth. People merit respect. People merit being cared about. And so these families, I think many of them for the first time feel like they have a voice that's being listened to. And that gives them a sense of power and control that they haven't been able to have. And that helps you feel more stable and contained inside. We
have a caller. Caller, your question?
Hi. I was wondering how the larger community in Beacon Therapeutic could reach out and help.
Thank you. Good question. Clearly, in the work that we're talking about today, it's the children's services. And in terms of how the community can help, there's various drives that we have to support the work, whether it's, donation of therapeutic materials, donation of volunteer time, and of course funding is always a significant need. We were fortunate to just have a fundraiser this past, actually a couple of weeks ago. It's our annual holiday fundraiser, and then we have another fundraiser during the spring. So that is something that if you're interested in reaching out to us and contacting us, I'm going to actually put the contact information back on, where you can go ahead and give us a call at the business office. And ask for Peggy Rourke, who's our development director, and she can share some ideas, particularly around the holidays. One of the things that we look for, and it's wonderful, a lot of organizations are able to adopt our kids, so they have their Christmas presents and those kinds of things, but I think there's always a need. I think, Victor was talking about our families are very needy. We have homeless families. They have a lot of basic needs, so things like our Fresh Start kits, which are able to provide families with basic starter kits for their new homes, and particularly for new moms, offering them the opportunity to get the strollers and all the things that new moms need, diaper bags and all those kinds of things. So there's donation opportunities as well. Good question. Victor, you clearly do a lot of work outside of Illinois as well, consultation, and there's been so many challenges within the current climate of funding and reduction in services. Could you shed some light on some of the impact that you've seen on services or how you've seen it realized at Beacon in terms of impact on staff, impact on services? How does that kind of, through your eyes, how is that evolving?
Wow. Well, it's not evolving well, unfortunately. I think one of the things that's happened is that the funding situation is so uncertain that staff are starting to experience very much a lot of the things in their own lives like the families are starting to experience. So it's not just that they're experiencing the family stress, but they're starting to experience their own stress. And this uncertainty really makes it very difficult to keep doing the work. What I've found on many of my consultations is that before we can start talking about the work, I have to check in with staff and find out how they're doing and give them a chance to share what's going on with them. And after about 10 or 15 minutes of doing that, we are able to turn to what's happening in their work. And then what amazes me about the Beacon staff is how they're able to continue to do the most exquisite things with these families under the most difficult circumstances, not only with the families, but in their own personal situations.
one of the things that I know that I really enjoy that you do is, it's obviously it's talking about what's working, but it's also the use of videotape. And, describe a little bit about how that works, or some videotape anecdotes that would help and kind of understand in a broader picture what we're doing.
Well, I think when you're confronted with a lot of stress, you don't think about what the little things are that make a difference. And I'm working with staff to make videos of everyday routines. And I tell them, anytime the child smiles and the parent smiles, you're doing your job. And when we can capture these moments on videotapes and make a video scrapbook for the family, then what we have is what I would call a collection of ordinary miracles. And it's just so wonderful to be able to gather these together and give this gift to the family and let them know and see how important they are to their children. All parents love their children. That's not the problem. But what all the stuff that's happening in their lives and has happened to them, sometimes that interferes with children getting the message. They don't get to know that they feel loved. And so whenever we can help children experience that love and caring and protection from the parent and have fun, and we can get it on video and just make it a permanent record, it really highlights what's important.
Well, I recall the picnic that we have, and you kind of set up shop in a tent, and you do videotape the parents, which I think is great, because I think my son actually gave me a book, and it was likening it to stepping over little miracles. And I think with many of our families, they are faced with so many overwhelming challenges that I think they do step over the little miracles and those chances where they're able to see their child doing the things that they should be doing, and can do. We have a caller. Caller?
Hi, I have a question for Dr. Bernstein. If you're a parent who needs help, where would you turn?
I would go to my local community mental health center. Beacon is one. There's a lot. There are fewer resources than there used to be because of the cutbacks. But I think if you have a chance, Susan, I think, could answer this better than I. But I think there's help out there to be had, and I think that it's so important that you're aware you need it. Because when people ask for help, that is the absolute first step in being able to make progress. Sometimes the parents in our programs feel like even though they were beaten when they were raised and they didn't like it, this is what they know and this is what they feel they need to do with their children. And if you try to help them with that, they don't feel like they need help because this is how they were taught. And so if you're aware that you need help, that's a huge step. And Susan, I don't know if you have any more specific ideas for this.
Sure.
challenge.
Well, I mean, I think I'm going to put the overhead information on. But one thing that we do like to view ourselves as clearly as an entity that can provide referrals and linkages. And we're located on the south side. A lot of our services are citywide. However, we welcome other calls for individuals who are looking for support services, maybe on the north side, or on the south, west side or something, where it would be very difficult for us to actually provide these services. But there is our website there, www.beacon-therapeutic.org, or contact our business office. The numbers are listed there. The number 773-298-1243. We do, are able to provide referrals and linkages. A lot of our programs, most of our programs are free of charge. The school program is a program that is funded through the school districts, but many times we can provide support and advocacy so that individuals who feel that perhaps their children are in need of special education services, we can at least provide the education and help them kind of direct them in the right way. But I think it is encouraging you to call to get the help, at least to find out the information. And I think that's really important. What do you think, Victor, keeps you at Beacon? Why do you keep coming back?
Because it's fun. It really is fun. I love being around people who love their work. I love being around children and parents.
I'm actually, as you're talking, I'm going to put some pictures up of our kids because I think that's always great to see that.
To me, there's that ordinary miracle right there. And, I just like being part of being able to witness it and testify about it. I think that's what we get to do together in our work. And that just help people notice what's important. I think that's a message I'd like to give to parents out there is when your children are smiling, you're on the right track. When you're yelling and angry at them, you're on the wrong track. And so whenever you can help yourself remain calm and get to the place of enjoying your kids, you're really helping them know that they are special, and that's what all kids need, is to be able to feel special inside and to feel cared about. And even if, I know you love them, but they need to know it too. And what you're seeing here is what love looks like. So,
gosh, that's wonderful. That's really, really good. And one thing I guess, as a parent and feeling frustrated, and it's also for our moms really being able to offer them the setting where they can share their own frustrations in a safe environment. And I think that's something that I know the staff try to do as much as possible, because it is difficult when we talk about the families that we're talking about. It's being unsure of where their next meal is coming from, being unsure where they're gonna spend the night. Are they gonna violate some rule that's gonna jeopardize their housing? And I think that's where the support of the staff to be able to support the parent becomes so incredibly important. What other thoughts do you have?
I just can't emphasize enough how much parents, despite all their struggles, need to make children their priority. And when you do that, when they're number one, they can overcome a whole lot of poverty, just that feeling warm inside, feeling close to you. That's what children need. And I think that's what we try to do with the staff, is to help them make that happen with families and parents. I just encourage you to enjoy your children and to be close with them. And when you're upset, try and be away from them and not put that out there onto them.
One of the final thoughts, in terms of looking at the challenges that we face as a state, it's kind of the bigger picture issue, and proposed changes related to funding of our Little IOP program, which is, the program that works with the 3 to 5-year-olds. What do you think will happen with these kids if we're unable to provide these type of day treatment services for them? I mean, what are the options or resources available?
Well, the idea of that happening just brings tears to my eyes. And that's because what's happening now is that these kids are having a chance to have a stable, consistent environment in these programs where they can feel safe, and when they can feel safe, they can experience joy. But when it's not stable, you get anxious and nervous, and then it's very hard to get to a happy place. And what happens is you either fight to protect yourself or fight to show how frustrated you are. And I'm just concerned that if children don't get to be able to experience that, have positive experiences, and to view themselves in a positive light, they're going to be on a path that just leads them, I hate to say it, but into jail, because that's what happens when if you can't love yourself because somebody hasn't loved you, it's very hard to care about other people. And our programs do that for these kids, and I don't see any substitutes coming along. These kids are living with trauma day after day, and we need to help them have some protective factors so it doesn't chew them up and spit them out.
Well, and I think that's something that we're really trying to mobilize our families to understand the impact, and and let the powers that be become aware of what the challenges are going to occur if these types of programs are defunded. And I think that's something we'll be talking more about. Want to thank you for joining us today. It really was a pleasure. I know Beacon truly appreciates the work that you do for us and with us. And I think of all the meetings the staff attend, they consistently say your meetings are always the most comforting and informative. So I just want to put final information on Beacon. And in terms of our contact information, and we will be here again next week. Thank you very much.